Hello and welcome to our channel, Moving Faster with Parkinson's disease. Today we are going to discuss about a common phenomenon that we see in the clinic. When patients tell you, doctor, my medications are not working well. I don't feel anything. I don't feel any benefit when I take my Levodopa, my Cinemed, my Ritari. Well, I will give you 5 reasons for this common phenomenon. My name is Dr. Zayas. I am a movement disorder specialist. Reason number 1, you might have the incorrect diagnosis. You might not have Parkinson's disease. If you have any doubt, please try to see a movement disorder specialist. What is that? A movement disorder specialist is a neurologist, full residency, full training in neurologists, with extensive training, extra training in Parkinson's disease and other movement disorders. Usually take a 1 or 2 years to do that. This is a subspecialty in neurology, like cardiology is a subspecialty in internal medicine, or GI, gastrointestinal diseases, is a subspecialty in internal medicine. Also remember that even though that you are responding to levodopa, that doesn't mean that you have Parkinson's disease. There are actually some diseases similar that look similar to Parkinson's disease that they might respond to levodopa at least mildly or during the beginning of the process. Make sure that you understand that the diagnosis of Parkinson's disease is not just based on a test like an MRI or a DAT scan. The diagnosis of Parkinson's disease is a clinical diagnosis, is based on your clinical findings. Also remember, this is the reason number 2. You are evaluating the effectiveness of the levodopa, of the Cinemed, based on the tremor improvements. This is not the best way to do this. Why? Because tremors are one of the less responsive motor symptoms in Parkinson's disease. Medications such as levodopa, which is the best medication that we have available currently, is better for motor symptoms such as slow movement and the stiffness. Tremors, so. Some patients respond very well to the medication in terms of tremors. Some patients don't respond at all, and some patients require higher doses. Still, we cannot predict which patient will respond better in terms of tremors to medications. Remember also that 25 to 30% of the patients with the diagnosis of Parkinson's disease, they don't have any tremors at all. And that doesn't mean that they don't have Parkinson's disease. Actually, tremors is not a requirement to make the diagnosis of Parkinson's disease. A slow movement, which means bradykinesia, is a requirement to make the diagnosis of Parkinson's disease. The bottom line here is that do not judge the effectiveness of the medication based on the tremor. Because like I mentioned before, some patients do not respond to levodopa in terms of the tremors. It's better to evaluate the effectiveness of the medication based on the speed of the movement and the stiffness. Reason number 3, you have Parkinson's disease, but you are too good. You look too good. So, which means that you don't have enough room to improve. It's not the same thing having a patient with significant motor dysfunction, a lot of slow movement, a lot of stiffness, that a patient with mild symptoms. Those patients with mild symptoms, they don't have enough room to improve, so it's hard for them to notice benefits. Also, it's important to notice that some patients, they have a tremor predominant Parkinson's disease. And remember, I told you before that There are patients that the medication, the levodopa, don't do anything for the tremors at all. And that doesn't mean that you do not have Parkinson's disease. Reason number 4, you are taking a very low dose of levodopa. Probably you are taking 100 milligrams of Cinemet, which is carbidopa, levodopa, 3 times a day, which means that you are taking a total of 300 milligrams daily. This is actually a very low dose. Some patients require higher doses in order to see some benefits, in order to feel the on phenomenon, okay? You cannot tell when you are wearing off if you never feel the on, okay? So in order to say that you are not responding to levodopa, to Cinemet, to retard, you need to reach at least 600 to 1,000 milligrams of levodopa daily. And some experts even recommend higher doses than 1,000 in order to say that you are not responding to levodopa. Reason number 5, and the last one we are going to discuss. You might be having problems with the absorption of levodopa. For example, remember that proteins, amino acid proteins, might interact with levodopa at the level of the intestine, where the proteins, amino acids, and levodopa are absorbed. Okay. Only levodopa is the one of the medications that we take for Parkinson's disease that might be affected with this phenomenon. The other ones, don't worry about it, okay? Another important factor is that not everybody is protein sensitive, which means that there are some patients that they can take the levodopa, the Cinemet, with a steak, with tuna, with proteins, and nothing happened, okay? They are able to absorb like nothing happened. They are able to absorb the proteins and the levodopa without any problems. They don't feel any difference. There's no way that we can predict which patient will be having issue with the absorption of levodopa and the proteins. You need to test yourself. One day you take the pill, the carbidopa, levodopa, with tuna, with a steak to see what happened at the same time. And another day, you try to separate. For example, you take your pills at least 45 minutes, 60 minutes, 45 minutes before the steak or the tuna or chicken breast. And then see what happened, if you feel any difference. That's the best way. Another important factor is that make sure that you do not mix iron with the levodopa. When you have iron deficiency, you have to take iron supplementation, right? So if you mix the iron with the levodopa, with the carbidopa, levodopa actually might affect the absorption of both the carbidopa and the levodopa. So it's better to separate. Some people recommend 2 hours, okay, to avoid this interaction. Also, make sure that you don't have what we call H. pylori infection. There are plenty of data showing that people with this type of infection might have problem with the absorption. And when you treat this bacterial infection, patients improve motor symptoms because they are absorbing more the levodopa. So I would recommend that if you are having symptoms suggesting peptic ulcer disease, such as feeling bloating, fullness when you eat even a small dose of food, when you have a burning sensation in the stomach area, tell your doctor to test you for H. pylori, because that might improve your quality of life. So these are the 5 reasons for you to not feel the sensation that levodopa is doing something for you. If you like this channel, please don't forget to subscribe and like. See you soon.